Patients live a lot of years with this disease. I see this like an opportunity to develop in the patients skills and knowledge to help patients to live with more quality of life. My name is Miguel Padilha. I'm from Porto in Portugal. I'm a nursing teacher in the Porto Nursing School. My challenge to be a nurse is helping the patients and at the same time helping nursing to develop strategies to be more significant to the patients and to the society. The name of the project is Self-Care Management of Patients with Chronic Obstructive Pulmonary Disease, COPD. Chronic obstructive pulmonary disease is a disease, chronic and progressive, that affects the respiratory capacity of the patients and have effects in local and systemic organs and reduce the energy available for the achievement of self-care activities. At this moment, the number of patients with COPD is the result of the lack of information in last years about the consequences of smoking habits. It can be only controlled, but we don't exist a cure for this disease at this moment. The principal goal of this project is to achieve more systematization of nursing action in the context of the hospital. We develop with nurses some guidelines in this context to help patients to develop self-care management skills. When the patient arrives to the hospital, the nurses assess condition. After, we evolve to the development of and facilitator awareness about the progression of the disease. Simultaneously, the nurses help patients develop involvement in the healthcare management. That implies to help patients to identify the accessibility to the health system. After, the nurses evolve to another stage that implies development of skills and knowledge. In this stage, the nurses help patients develop skills in inhalation technique, those inhalers, developing self-control dyspnea, helping patients to manage the energy to reduce the impact of the disease in self-care activities, help patients develop strategies to manage the stress, and helping patients to quitting smoking and maintain this behavior.
So at the beginning, I remember thinking that it was a little bit scary because we just thought, I don't have time for this. I have to give medication, I have to change the patients, do all of that. I don't have time to sit and talk with them. Right now, it's very different. I know that I have 5 minutes, 10 minutes of my time to sit nearby a patient and talk with him, try to understand if he knows about their own disease. It doesn't make my life easier, but it makes certainly my life better because I feel better as a nurse. I'm not just giving some medicines to my patient and telling him, okay, you are better now, go home. Now I'm training my patients. I feel they earned something with this that they weren't earning before. It's not easy, but it's not too hard also, as I thought in the beginning.
I think this development of this nursing strategy can be very, very important in 3 fields. First one, for the people with COPD that can live with more time, with more quality of life. It can be a contributor to nursing knowledge in the field of self-care that is very important for the whole chronic disease. In another field, we can have greatest results in optimize the health resources, and consequently we can optimize the costs of the health system.
This approach must be used with all other long-term issues. It's not difficult, and we have that experience. We start with COPD, and now we are almost, without trying, using it in other illnesses like diabetes and cardiac problems.
I think with the work everything is possible. We are faced with challenge, a big challenge in patients with limits of resources, but I think if we can manage well, we can evolve for another stage of healthcare. I'm very happy, and I think it's a change that works, a little change that works, that really works, and probably it will work in next years.